So in this next chapter, we're going to talk about supplements. So why talk about supplements? This is such a fascinating area because people get such varying advice. So some people say it's just to take folic acid up into week 12. Some people say to take things all the way through. But what do I see as a doctor? So part of my passion in creating this brand is because of the deficiencies I see. One of the deficiencies I see is iron deficiency anemia. It's so common. And many people don't realise it can actually have quite serious effects. So iron deficiency anemia can lead to effects such as growth problems in the baby. It's not just about mums getting tired. It can also lead to problems with increased hemorrhage after delivery as well. And so we created a supplement called the Essence Capsule that's got higher amounts of iron in it to reduce the chance of iron anemia. And an audit of our ladies who use the supplement has shown fantastic results. We've got 5-star reviews in being able to treat anemia because of the small amount of iron that we put in the capsule. That means that it achieves what's needed every day. The other deficiency I want to talk a little bit about and links into nutrigenomics that we discussed in the last chapter is choline. So choline is is something which has been newly discovered in the last few years, and now is recommended that all pregnant women should include it in their diet because we know up to 75% of people are deficient in choline. What is choline? It's like a B vitamin, but actually it's really vital for brain growth and development. It links in with folic acid and also omega-3 to make sure that the nervous system of the baby is produced in an optimal manner, such that we know that if mums are deficient in it, it can affect the cognitive ability of the baby. So a brain structure called the hippocampus is smaller, and we also know that there's a reduction in autism in mums that take it. Some studies have shown that if mums have got higher levels of choline, if the baby needs to be admitted to the neonatal unit, the baby has a better outcome because it also protects the brain against infection. So this is really vital, and we have the only UK supplement currently that contains the right amount of choline. So you can get the choline in the Essence capsule as well. The other thing I want to talk to you about, again, which is all about the nutrigenomics, is the omega-3. So we've got a really good capsule that's got the right amount of DHA in it, which links in, as I've said, with the choline and also the folic acid for nervous system and brain development, but also has the added effect of being anti-inflammatory. So if you've got a history of eczema or asthma or even nut allergy within your family history or yourself, do you know that omega reduces the chance of that inflammatory condition by up to 30%? So really important to consider taking that, because otherwise, if you don't eat enough oily fish in your week, you won't get the right amount that's needed. The other thing which I'm really excited about, and I think every pregnant woman should know about, is your microbiome, which links into the gut-brain axis. So what is this? This is all about how we've got wonderful bacteria that exist within our gut that link into how our brain functions and works, because ultimately the health of your gut defines certain factors or compounds that are able to be absorbed through the gut that trigger health or switch on unhealthy genes. An example of this is if you have a healthy gut, you're less likely to have depression because the bacteria at the gut interface creates serotonin, which is your happy mood hormone. So we know that in women that take probiotics, it can be just as good as a mild antidepressant. And that's what all the studies show. So really important that you maximize that. The other thing about probiotics is that it's really important in reducing urine infections, vaginal infections such as thrush, group B strep, and we also know really good recovery as well after deliveries in terms of reducing any infection. So we created a capsule called the Protect capsule because we really think it's protecting you against sort of these infections with a good amount, a dose of healthy bacteria of 20 billion with a prebiotic as well. And the reason why we think that this is important is that sometimes you can't gain enough from the fermented foods that you may choose to eat, such as kimchi, sauerkraut, kefir. You need an extra dose to really support that gut health to be maximised and to be strong for you and your baby. We also know that when we're thinking about the gut axis, you create a microbiome within the vagina, also across the placenta, within the oral microbiome, and also in breastfeeding, which allows your baby to benefit from those healthy bacteria. So their immune system becomes stronger. So women who take probiotics, the babies are less likely to end up with allergies and also have a stronger immune system when they're born. And the last thing I'm going to talk to you about, which is a bit controversial, is collagen. So I'm taking and we're pulling collagen away from the beauty industry because collagen actually is really protein broken down into components that your body can absorb more than it would from normal food. Now, why is this important in pregnancy? Because it's not just about the skin. Collagen, your bones are formed of 70% collagen, the ligaments, the muscles, the pelvic floor, the cervix, the womb. The list goes on and on, the heart, the eyes. And so if your baby's getting these wonderful compounds through, it helps to really structurally make sure that your baby's fit and healthy. We also use and source a collagen, which is the same that was used in medical studies to protect against osteopenia, which is bone thinning, and also things like teeth and gum health as well. And we've fortified it with extra vitamin D and vitamin C. So that will bring me on to one of the other last supplements that I want to highlight to you, vitamin D. So, initially when vitamin D came out, most of us were just thinking, well, it's just a vitamin, does it really matter? I think we've learned it really matters, particularly after coming out of the pandemic, because vitamin D is really important for your immune system. It's really important for your bone health. And we know that in mums that were low in vitamin D, ultimately it affected babies who were born with softer bones and ended up with a condition called rickets. So the advice is for you to take at least 1,000 international units a day of vitamin D. But really, if we're looking at really good supplementation, ideally 2,000 would supply all the needs for you, for your bones, your gum health, your immunity, and also supply enough for the baby. And I'm also lastly just going to show you one of my favourite books. So this is Real Food for Pregnancy by Lily Nichols, which really highlights all the nutritional needs that you have together with advice on supplementation. And another one of my favourite books, which is by Michelle Henning, and that's Grow Healthy Babies. And that outlines a lot of the science about all the nutrigenomics. And together with these, I think these are must read for every body that's having a baby, because it will help to guide you to understand what you can do to make sure that you grow a healthy and strong baby, not just for now, but for the future.